it's been like 3 years where I started to just accept that this is how my life was going to be, and now I feel like, oh, hey, there's a light.
It's been a long time coming, man.
Yeah.
So, specifically on the shocking side, that's why I say that. The normal shape and sort of arrangement of your cervical spine should have a normal curvature to it. And you'll notice it's actually, not only is it straight, it's actually pushing back, which will point to a whiplash trauma. And you know, sometimes it can be tough to dig them up. I remember we were talking about hockey and different things. You were so young when it happened originally, because at this point you already have lipping and spurring and decreased disc height. You're going to notice, and this is a strange phenomenon, beyond what you would consider like pain or numbness and tingling, neurologically, whenever that is off, it comes with it an emotional component of disturbance as well. The main thing we all sort of complain about and report is irritability, and that feeling of being overwhelmed. It just seems like you can't handle as much.
Yeah.
You don't have that buffer. People tend to, the smaller things will set you off. You just don't have that grace that you would normally.
Gotcha. That's
in
funny.
versus out.
I mean, because I've always, for the most part, too, been like a pretty happy-go-lucky, laid-back person, but like, yeah, like for most of my life, if we could all be joking with each other and someone hits the wrong nerve kind of thing, and I just go off, like no way to stop myself. You know what I mean?
It's just you're more irritable.
Yeah.
Is the main word. Because neurologically, somebody's sitting there pinching your brainstem. It would be like if I was sitting here like just
doing that the whole day.
all day,
Yeah.
and finally, like it would just be somebody saying just anything to you, and you're gonna snap.
Yeah, yeah.
You know, it's like an invisible pinch on your brainstem.
Wow, that explains a lot.
So just neurologically, you're just kind of irritated. Right there. Whenever the atlas goes out, that dorsal root will inflame like that. And I'm going to check your overall posture like I just did and this nerve root every visit. Come down onto your side, legs up on the table. Slowly get you in the perfect spot. So just let go of that head. Good, and last thing, let the head fall on that headpiece. Beautiful. You're gonna hear a click. Good job. Alright, let's rest you for a few minutes. Okay. The worst part's driving after you get adjusted.
Oh, really?
Alright, feel that right side?
A
little bit different, huh?
It does. It doesn't feel as sensitive where you're like touching it.
Exactly.
Because before it like wasn't pain, but I could feel you touching it. You know what I mean? And I could feel exactly where it was.
I'm not digging quite as hard, but you're not going to feel that same pressure on the nerve.
Yeah, that's I guess the best way to say it. I don't feel that as much.
Yeah, it's like a weird. It's hard to describe feeling because it's nervy.
Okay.
Yeah. But it's gone, man. It's melted.
Feels good.
How you doing? What's the latest?
Pretty good. I've actually haven't been wearing my brace. A, because it needs to be washed, and then B, it's like giving me a little bit of a rash underneath, but like surprisingly I was okay without it. I was really excited to like kind of start to feel that way. I'm definitely gonna put it back on just to help again, but yeah, like that after that last adjustment I was really nervous that the last time you did an adjustment it was out, and I was really happy that it hasn't been out, and I've actually been really feeling better. I'm still a little like sore and you know like with my shoulders and everything, but like I don't know, like really good. Yeah.
You're getting stronger.
Yeah, that's definitely what it is, yeah.
So, how you feeling?
I feel pretty good. I feel Friday, it's been a week since my first adjustment, and been more energetic, sleeping better, not as foggy, not as cloudy. Headaches, which I normally get constantly, usually take like 4 Advil a day. I haven't taken maybe 3 Advil in a week. Headache yesterday and a little bit today, but not like they normally are. Just all around better, different, more energetic, not foggy, not cranky. So yeah, there's definitely been a shift in the last week.
Amazing. You're in. I'm just working some of these muscles here.
That's fine. You feel like my left side is tight.
The right side pulls up. Such a good girl. Give me 5. You want to do that yet?
Can I get 5?
Thank you.
Stop it.
Alright, so let's lay down one more time. So good.
One more time. Just like that. Good job.
Oh, that's perfect.
Good
That's
job.
so good. Can I move you over just a little bit?
Yes, please.
You're amazing. Patient of the day. Good job.
Even the hips were like
Yeah.
off like that.
And her leg check just dropped down. I don't know if you were able to get that. It was pulling up so hard. Right. Think you're in alignment or do you think it's out of alignment? Not sure yet? It's okay. Scoot back. You're still holding what I did to your neck.
I have it.
It's pretty cool, right? So your back doesn't hurt.
Hi guys.
Alright, your brother's up.
So I'm looking at.
He's been having more takes or what? What's been
Yeah, he's had quite a bit of neck rolls, but he's got a new one that's formed in the last couple of days. It's driving him crazy.
What do you
His
got?
eyes. A lot of blinking.
Do you think you're out of alignment?
Yeah.
Okay. Why do you think that? Besides the ticks, anything else?
Nope.
Let's see.
Yeah, it hurts a lot.
Sorry it's hurting you. Just gotta make sure. So mom's gonna throw your smartphones in the water.
I don't even have a smartphone.
iPad, what is it?
Oh, I don't really know.
What is
Forgot.
it? Video games? What do you do? What's your
Oh,
bag?
It does Fortnite all day long like this.
Ah, Fortnite!
All day long.
No, I'm like this.
I was
I'm
gonna say,
like this.
Listen, it's been like 3 months of this. We know what it looks like.
I'm not like that though. I'm like this. No, you're like this. I look
Totally. He
straight.
stands underneath the TV.
I look straight.
Don't
Stop.
Look over.
Don't take my Fortnite.
How far?
Good job, Luke. I know that was tough, man. You did amazing. Proud of you, buddy. Stay right there. Good job. Good man. Your job is going to be to rest for like 10 minutes. Cool.
I can definitely feel it like through my shoulder blade and everything. It's definitely tight again.
Oh, yeah.
Yeah, that feels wonderful.
Just let go of that head. Let it fall on the headpiece. Beautiful.
I didn't know if it was a bone or a ligament, but I felt it go, like almost like floating in water, like a log go down towards the table and then back a little bit and rotate this way. It's pretty cool. I mean, it was like the smoothest movement, like this and then like that.
Did you notice that last time?
No, that's the first time I've ever felt it. So I was telling him which way it went, and he said that's exactly which way it's supposed to go. That's crazy. I'm like, yeah. No, I totally felt it. Not only, I mean, you can feel it, like it was like moving a log underwater. Like it's just so smooth. It was like towards the table and then just ever so slightly back that way too.
Yeah, you got a good set. Feel that right there, buddy?
Yeah.
That should not be there. It should feel like how this side feels.
Mm-hmm.
That's a nerve that is swollen. And so when I adjust you up here in a moment, that's going to release. Come down onto your side. Bring your legs up on the table. You're going to hear a click. Good job. Stand up to the end. All right, so, good. Let me have you sit on the end. Scoot straight back. That's actually good. Lay back for me. But you basically make a line right down, head, trunk, all the way down through. And then you'll see how the body will actually contort. Do you feel that? Mm-hmm. Yeah. So after I adjust you, I want to feel that release, okay? So in your brain, snapshot how that feels. Did that knock you into a migraine?
No.
You okay?
Just my jaw's been hurting like
One-
over the weekend. Is
More
that
one-sided?
all
right
this
side?
side?
Okay, so swing over real quick. When the atlas is out, you will have head tilt, along with your body hypercontracting on one side to mitigate that. There's going to be asymmetry with how your jaw articulates with your skull. So instead of properly evenly tracking and sliding, with that tilt, one side's going to be compressed, and the other side's going to have a little bit of stretching. Does that make sense? So one side can feel tighter and guarded, and the other side can have a natural compression of the jaw.
And that will release.
Yes.
Okay, cool.
What we're going to do is come down onto your side. You're going to bring your legs up on the table, and I'm going to slowly get you in the perfect spot here. Baby scoot towards your feet just a little bit with your hips. Bend your knees. Good job. Just me, don't worry. 14. Just let the head fall on the headpiece. Good job. You're gonna hear it click, don't move. Good job. Awesome. Get a grip on my shoulder. Come on up. Good. Feet on the floor. Feel better. Here's the idea.
Good.
I'm not
Yeah, I
pushing
don't-
quite as hard, but do you notice a little
Yeah.
bit different quality in there?
Yeah.
Pretty cool, right? I know I've said cool like 50 times today. That's my word of the day. Bom, bom, bom. So how did you do?
The first night was weird.
Mhm.
I don't know how to describe it. And like the second night was a little tense. Like I wore the collar at work a little.
Good.
Now I just have a little back pain. I don't know if it's just 'cause my posture or what, but I feel better.
How's your head?
My head aches.
Yeah. Any
They're-
different?
The one main thing, I'm still getting a headache, but I don't have the knot that
Okay.
I typically have.
Is it the same intensity or duration? Okay. So it's just kind of more low grade.
Mm-hmm.
Cool. Does it
Yeah.
last the same amount of time? I think you said they were like all day.
Typically I've been knocking them out in the mornings,
Okay.
so
So they're easier to manage,
yes.
at least. Cool. So, what would you rate it if you had to rate it from 0 to 10? If 10 was like your head's gonna explode.
Like a
0 was nothing.
4,
And normally you would walk around with what?
an 8, 9.
8, 9. So you couldn't manage it at all before. It was just Cool. So you're getting
Yes.
there. Good. Scoot forward and let me check your neck.
Okay. Just like right there?
Yep, just like that, yeah. So what was the first thing you noticed after like the first day, or what was?
It was kind of like at first when I reached the 3-hour point and took the brace off, and then I just felt, I don't know, I felt better right away, but I was like, just kind of like, okay, well, how long is this going to last thing at first, you know? I didn't just go straight to being like, oh, miracle. But then the next day when I woke up after actually sleeping really well for the first time in probably 3 years, really, it was almost like an overwhelming feeling of just like really good, just felt really good, just everything was good. Felt like me again.
Cool. Congrats, man.
Thanks, man.
You're back.
Yeah, it feels incredible.
You're back on, man.
My chin's been up. I've been able to walk around like, hey, I feel good, you know?
Is she adorable?
She's adorable.
Oh, look at her.
Michael, make her smile.
Goodness.
How's it going, babe?